Hello, you're welcome to my platform. I am Dr. Sandra and I am a surgeon. I hope you become aware and sensitized about the different surgical conditions. Today's video is about leprosy. Leprosy is a chronic, long-standing condition that commonly affects the skin and the peripheral nerves, and it is commonly due to a bacterium called Mycobacterium leprae. Mycobacterium leprae, the bacterium that causes leprosy, thrives best in temperatures that are lower. For example, those between 27 to 33 degrees Celsius. Under these temperatures, the Mycobacterium leprae multiplies very fast. The Mycobacterium leprae, the bacteria that causes leprosy, is also an obligate intracellular bacterium. That means that it thrives best inside a cell, specifically the cells of the immune system called the macrophages. In addition to the skin and the peripheral nerves, the Mycobacterium leprae also affects other parts of the body that have a lower temperature. For example, the eyes, the upper respiratory tract, and the muscles. Leprosy can be transmitted from the infected, untreated individual to a healthy individual through inhalation, that is breathing in of the Mycobacterium leprae. It can also be transmitted via direct contact with the skin lesions of the untreated infected individual. It can also be transmitted via direct contact with a given animal called the armadillo. The armadillo is an animal that is native to America, and it is a natural reservoir for the Mycobacterium leprae. In order for the individual to end up with leprosy, they have to be exposed for a long period of time to the source of the infection. The incubation period, that is the time between exposure to the time of appearance of the signs and symptoms, is usually between 2 to 7 years. This is because the Mycobacterium leprae takes a long period of time to reproduce, that is around 13 days. When the Mycobacterium leprae enters into our bodies, our immune system will respond differently depending on how competent it is. The immune system, by the way, is the system within our bodies that is responsible for protecting us from invading germs, for example, bacteria. In our context, the Mycobacterium leprae. In a setting where the Mycobacterium leprae infects an individual that has a good immunity, the cells of the immune system called the macrophages will engulf it. They will swallow it. They will then present it to another cell called the naive CD4 T lymphocyte. Once presented to them, the naive CD4 T lymphocytes will now multiply into other forms of cells. For example, the T helper 1 lymphocytes. The T helper 1 lymphocytes will produce a given chemical called the interferon gamma, and the interferon gamma has various functions. For example, it will activate the macrophage to kill the Mycobacterium leprae that it initially engulfed, the one it initially swallowed. This can as well lead to the destruction of the tissues in the affected area. The interferon gamma is also responsible for the recruitment of other macrophages, and this will surround the macrophage that initially swallowed the Mycobacterium leprae. When the macrophages surround the macrophage that initially engulfed, that initially swallowed the Mycobacterium leprae, there will be a wall formed around it. Other macrophages will elongate and will transform into other cells called the epithelioid cells. Other macrophages can join together to form the Langerhans giant cells, and this will contribute to the wall formed around the macrophage that initially swallowed the Mycobacterium leprae. Other cells of the immune system, for example the lymphocytes, will also be recruited in the area, and this will also contribute to the formation of the wall. Fibroblasts will also be recruited in the affected area, and this will lay down a tissue called collagen, and it will also contribute to the formation of the wall. And this will prevent the spread of the Mycobacterium leprae to other parts of the body. The end result is a cluster of cells called a granuloma in the affected area. On the skin, for example, these granulomas, this cluster of cells, will join together and they will form a lesion on the skin that is well demarcated, well localized. Sometimes it can be red in color, but sometimes it can be hypopigmented. That is, it might look paler or lighter than the surrounding skin. This, by the way, occurs in a setting where the individual had a good immunity and the macrophages were successful in the elimination of the Mycobacterium leprae. However, in the setting where the affected individual had a low immunity, the macrophages will not be activated to eliminate the Mycobacterium leprae that they engulfed, that they swallowed. This means that the Mycobacterium leprae will continue to multiply in large numbers inside of the macrophages. Therefore, there won't be formation of a granuloma, the cluster of cells. Instead, what will happen is the Mycobacterium leprae will continue to accumulate in the macrophages, and after some time they will join together and they will form what we call nodules. Nodules are small hard swellings below the skin. Therefore, the type of leprosy that the affected individual will end up with will be dependent on whether they had a good immunity or they had a bad immunity at the time of infection. The types of leprosy include tuberculoid leprosy. Tuberculoid leprosy is a mild form of leprosy. It usually occurs in individuals that have a good immunity. Tuberculoid leprosy usually presents with well-localized, well-demarcated skin patches. They are usually red in color or they are hypopigmented, that is, they look paler or lighter than the skin surrounding them. These skin patches are usually 5 or less in number. The disease is more localized, but it is associated with more deformities because there is early involvement of the nerves. The lesions usually contain few numbers of the Mycobacterium leprae, and this is because the individual had a good immunity, so majority of the Mycobacterium leprae were killed off. They were eliminated by the cells of the immune system, the macrophages. Therefore, the affected individuals cannot easily transmit the infection to other individuals. There is also associated sensory loss, that is, when you touch that skin patch, you cannot feel that area. And this is usually the most dominating feature of the tuberculoid leprosy. That is the loss of sensation. Tuberculoid leprosy usually has a good prognosis, a good outcome, because usually the individual has a good immunity, so they can easily eliminate the infection or they can easily prevent the infection from spreading to the rest of the body. Another type of leprosy is the borderline tuberculoid leprosy. Both the tuberculoid leprosy and the borderline tuberculoid leprosy usually occur in individuals that have a good immunity, and they both fall into the category of the paucibacillary leprosy. This is because the lesions usually contain very few Mycobacterium leprae, because the immune system was so good that it eliminated most of the Mycobacterium leprae. So paucibacillary comes from the word paucity, few. The third type of leprosy is the lepromatous leprosy. Lepromatous leprosy is a severe form of leprosy and it occurs in individuals that have a poor immunity. The affected individuals usually present with red or purple lumps or nodules under the skin. These nodules usually contain a lot of the Mycobacterium leprae. And this is because the affected individuals had a poor immunity and they could not eliminate them Because the Mycobacterium leprae are many in number, the affected individuals of the lepromatous leprosy can easily transmit the infection to other individuals. On the face and the eyebrows, these nodules can join together to form bigger nodules, and this can result into a leonine fascie. There might also be loss of eyelashes and eyebrows. There can also be loss of sensation as a result of damage to the peripheral nerves. Blindness can also occur as a result of damage to the eyes. The affected individuals can also develop painless ulcers at the bottom of their feet. And this is usually because of damage to the nerves. There can also be paralysis or muscle weakness, especially for the muscles of the upper and the lower limbs. The fourth type of leprosy is the borderline lepromatous leprosy. And finally, the last type is the borderline leprosy. The borderline leprosy, the borderline lepromatous leprosy, and the lepromatous leprosy fall into the category of the multibacillary leprosy. Multibacillary means that the lesions contain a lot of the Mycobacterium leprae. This is because these three types of leprosy occur in individuals that have a poor immunity, so the macrophages were unable to eliminate the Mycobacterium leprae. The individuals that are commonly affected by leprosy include individuals that have a low immunity. For example, those that have HIV, diabetes mellitus, individuals on steroids or any anti-rejection drugs, maybe they underwent an organ transplantation. Individuals that have had a prolonged exposure to the untreated infected leprosy patient. Individuals that live in areas where leprosy is most prevalent, for example, Africa, Asia, and South America. Individuals that have physical contact with the armadillos. Armadillos are animals that are natural reservoirs for the Mycobacterium leprae. These animals are common in America. The complications of leprosy include permanent paralysis, permanent change to the appearance of the affected individuals. For example, these individuals tend to get a leonine fascie, or they tend to get a collapsed nasal bridge, and some of them get paralysis of the eyelids, lagophthalmos, upper limb paralysis, for example, a claw hand or a wrist drop. Some individuals can get a foot drop or clawing of the toes. Some individuals can develop ulcers on the foot, and these are usually as a result of damage to the nerves. So these individuals can easily get trauma to the foot, and they might not even realize that they got injured. The diagnosis of leprosy is a combination of clinical assessment and laboratory assessment. Under clinical assessment, we can do history taking and clinical examination. During clinical examination, we can look out for hypopigmented skin patches with loss of sensation. We can also look out for thickened nerves or enlargement of the nerves. Under laboratory assessment, we can do a skin biopsy or a nerve biopsy. So we take off a tissue from the skin or the nerve and we can look at it under the microscope. We can also use the same tissue for the Phyt Paraco staining, the modified Zn staining. The Phyt Paraco staining helps to identify the Mycobacterium leprae. We can also employ PCR. PCR can help to identify the DNA of the Mycobacterium leprae. We can also look out for the IgM antibodies to the PGL1 antigen, which is usually located on the Mycobacterium leprae. When it comes to the treatment of leprosy, the following can be employed. For the milder forms of leprosy, the paucibacillary leprosy, for example, tuberculoid leprosy and the borderline tuberculoid leprosy, we can employ a combination of dapsone and rifampicin. For example, the dapsone is supposed to be given daily and rifampicin is given monthly. And these are usually given for a total of 6 months. For the severe forms of leprosy, that is the lepromatous leprosy, the borderline leprosy, and the borderline lepromatous leprosy, we can employ a combination of 3 drugs. For example, dapsone plus rifampicin plus clofazimine. Dapsone is given daily and rifampicin and clofazimine are given monthly. And these are usually given for a total of 12 months, 1 year. When it comes to the prevention of leprosy, please avoid prolonged exposure to the infected untreated individuals that have leprosy. Prolonged exposure to the untreated infected individuals puts you at a higher risk of contracting leprosy. Please also avoid close contact to the armadillos. By the way, armadillos are natural reservoirs for the Mycobacterium leprae. That is what I had for you. Thank you so much for watching and listening. Please share my videos and also subscribe. See you in my next video. Bye.